Hi, my name is Charlisa Beckland.
Allison Jacoby.
Corey Terrell Joseph.
Elizabeth Knudsen.
Brian Villalobos.
Kelly Rankin.
Sean Elliott.
Anna Teeter.
Mr. Joyner.
Tiffany Jones.
Heather Price.
My role is to provide substance abuse education and intervention to students within the FCPS county.
And then we also get out there and we try to work within the classes and we work within the community. And we do a variety of different things to get the word out.
Provide education to students and parents on really preventing drug use.
So basically we offer activities and experiences to focus on like psychoeducation and stuff on the many ways marijuana, alcohol, tobacco, vaping, drinking and stuff can negatively impact students' lives.
Focusing a bit more on prevention. We've been doing a lot of like monthly news articles to sort of try to keep the community up to date on current trends. And we've also been doing like virtual presentations for parents to also allow them to be up to date as well.
And the school realizes that it's more helpful to talk to somebody about it.
Really do a lot of the discipline education. So if a student gets caught in the building with a substance of some sort, we'll typically get a referral through principal, admin to meet with them and give them some education around substances and how to make better choices and things like that.
And then we also had a non-discipline track where any sort of counselor, teacher, parent, administrator could refer a student to us if they had any concerns that the student was using a substance.
And then if there are some kids that are having an issue, they're able to reach out and we set up something and we talk about whatever they need to talk about.
About making good decisions and about things that are affecting them that may make them want to use drugs and alcohol. So talking about mental health concerns like depression and things going on at home.
To be able to provide a safe space for people and give them the ability to come in and talk about some of the things like related to drugs and other counseling topics and things of that nature. Just try to help guide them. When you come to a SAP, you're realizing that I need some type of help. I want some information and on this topic, and where are the individuals that you can come to. We're not trying to give you a consequence or anything like that. We're just trying to give you the information and be a solid object for you. So you'll know that if I go to Mr. Elliott, I know that this information will only be used to benefit me, not to hurt me.
If you're already using drugs or alcohol, we are a safe place to go to. We are not going to judge you. We are going to provide both the education and counseling to figure out why you're using and try to help you make better decisions towards a path to sobriety.
I've had students that I've worked with in the past bring friends to come see me so that we can just have some support or have a conversation around certain things.
And we can anonymously get them help. For example, if you wanted to make a referral for a friend of yours who was having a problem, I could take the information and act upon that information, and your friend would never have any clue that I got it from you.
There are people who care in the school. There's social workers, there's psychologists, and there's us. And we're part of a team that tries to help kids in any way we can.
We don't want to set it about, oh, you can only reach out to us during this time. If you have any concern, question, or just general curiosity about alcohol, tobacco, and other drugs, that's what we're here for the psychoeducation portion, and if need be, for the brief intervention or the referral process. So we want to be as open as possible.
But the earliest, the better. Like if you come and you're thinking about it or you got friends that do it, the best thing to do is to reach out. It's nothing wrong with reaching out early.
Nobody comes out and says I'm an addict. It's a thought process that goes along with it. Again, your attempts that you talk to yourself of, what I'm not going to do it this time, or when I go out with this group of friends, I'm not going to drink, or I'm not bringing the vape to school. So when you start that thought process, that means you don't really want to do it. And that might be where you want to start asking for help.
I just want to say it's never too late to ask for help. Even if you see yourself on a really bad path and you're making bad decision after bad decision after bad decision with using drugs or alcohol or any sort of dangerous behavior, it's really never too late. You can always have help. We've had people that I've worked with in the past, adults that have been using their whole lives or coming to help for the first time as senior citizens, and they're changing their life. So like, it's really never too late to ask for help. And you will be so shocked to find that like you are strong enough to make positive changes no matter what decisions you've made in your life.
So it's really how you feel comfortable. You can, if you like Blackboard, we can set up a Blackboard Meet. If you like Google Meet, we can set up a Google Meet. But you can reach out to us. We'll figure out how to get a hold of you.
I do have a Google number. So if you email me, I can give you my Google number and we can text if you want to do that.
Just email our phone number, and then I should mention also that I speak both Spanish and English. So for any parents who need this information in Spanish, I can obviously provide that for them as well. If any other languages are needed, I can certainly get a translator. That's not an issue.
If we're in a regular school setting, non-pandemic, a student could just walk into my office and have a conversation with me.
For me, it was I wanted to make sure that kids knew and families knew that, you know, the behavior starts in high school. The behavior starts in adolescence. You know, they don't start with using heroin or opiates. So I really want to get that message out there.
From working all those different spots, especially at the methadone clinic, when they all said like, it was really high school. It was really when I was a teenager that I started, and that's what changed my life forever. So kind of feeling like that I can come back to that spot and hopefully at least help one or two people, I guess, every couple months to stop them from making that decision that might change their life forever.
That if we don't get this education out to students now, then when they become adults and they don't have the same structure and guidance that they have when they're at school, that we're opening them up for possibly making bad decisions just based on the fact that they don't have the education to make better ones.
So it's really been like this awesome opportunity to take all my crazy experience of all different varying fields and things like that, and been able to focus it, and it's got me here where I'm like, oh, I can really make a huge difference if I can, you know, get in younger before people get to that stage where it's so hard to overcome such a powerful drug.
For me, it's always been like video games, like working on cars and boxing, right? And those are like the three activities that like are pretty much my self-care. And as I've become an adult, I haven't like, those things haven't become less appealing to me. I've just been able to buy more expensive versions of those things as an adult.
And so I think about, you know, what's coming up this weekend that we're going to do together, or, you know, what's the next trip that we're going to take together? You know, what's the next exciting thing we're going to do? So yeah, just making sure that I'm practicing gratitude for them helps me immensely.
And I like to talk to kids about what de-stresses them. There's so many good ones. Some of our groups, we do meditation and de-stressing types of things that they will usually say that they like that, something that they can take with them.
Well, what my motto is, you know, rough times are only temporary. And during those rough times, there's something to be learned from it. And a lot of people want to hurry up and rush the tough times to be away, but sometimes you got to go through that journey in order to truly understand the lesson behind the tough time.
So some of the support systems are the people that I rely on. First and foremost is myself. And what I mean by that is I have to do a check-in with myself to be able to discern the difference between when I need to reach out to others versus I can handle this on my own. If I have been attempting to handle something on my own for a while and it's obviously not working, then that means that it's time for me to reach out to others.
Life is about people, okay? And the key to happiness, okay, and the key to success and the key to support in your life is having relationships with people. In the perfect world, as you're growing up, it's going to be your parents. We know that that's not always the case.
And I think it's hard as a teen sometimes to ask for support from certain people. So I think it's important just to get it out there that it is okay to ask for support. You're not a burden. You know, we have people for a reason. Use your people.
We are all
Here
For
You
reach
Shout
To
us.
Anytime.